Hi, my name is Joyce Wanga. I am the Communications and Advocacy Lead for Women Working with Women, and that is 3W. We're currently implementing the Querying Safe Abortion project in Western Kenya. In my capacity and in my role as the Communications Lead, I have taken part in a lot of trainings with the Community Health Management team. We have also worked with healthcare providers and the community at large. We have had value clarification trainings. These are essential in offering safe abortion services to queer persons. We've also had roundtable setups with the county health management team, and they are important bodies in decision making and policy implementation in the country. And this has been important because during these conversations we are able to inform them on the needs of queer persons, because we realize that a lot of healthcare interventions are usually generated from a heteronormative perspective without factoring in the unique needs of queer persons. You know, in the process of intending to clarify the values and change the attitudes of others, I've actually also gotten to learn because some of the sessions we've had actually showed us safe abortion is a sexual reproductive health need for everyone. And I have also seen and heard the stories of various queer persons who have suffered through not being able to access this very, very important services. There is a need for community engagement in safe abortion interventions because this helps us reduce the stigma that they face. We look at a lot of sexual reproductive health care services are offered without the inclusivity of LGBTQI persons, and that's why there is a need to involve the voices of the queer community so that we understand their unique challenges, and understanding their unique challenges, then we can meet them at the areas in which they need, because we may be solving a problem that is not really a problem until we have them on board to give us their perspective. The other way in which community engagement is important is because it actually builds support, because when you find this is a very intimate and close-knit community, so you'd find when you are coming up with interventions, especially around health, it's not easy for you to just go to one person and tell them, this is what I am doing, this is what I want to solve, you have to have a buy-in, and our buy-in is the community engagement. So having conversations and knowledge-based trainings with members of the community has enabled us to actually do more of the work and impact more, because now they are open and actually realize that this is a need for them. Another way this actually helps us is because it creates empowerment, because you can see the health-seeking behavior has been transformed amongst queer persons, because now they understand their bodies, they understand their reproductive rights, they understand what the legal restrictions are and how to approach them. They know where to go when they need healthcare, so that they do not resort to unsafe methods of terminating a pregnancy. So that is some of the ways in which we have engaged the community in our work, and we continue to do more even on social media. We're looking at ways in which we can have more advocacy work, but the only way we can do that is limited to our public health approach and not a rights-based approach. So those are some of the languages that we're using and we're learning in this as we're implementing this project, but it's been an amazing journey, and we are looking forward to having more.
My name is Penina Owino. My preferred name is Pesh. I am a queer human working in Kisumu as an abortion champion under 3W, that is Women Working with Women. Well, the project has had a lot of impacts, and I'll only mention but a few. Because first of all, I can openly talk about abortion, which is something I was not comfortable talking about. But you know, after the project and we sat down and we talked peer to peer about abortion, I was like, so we can actually sit down and talk about these things, okay? So like it's no longer because, you know, growing up, I grew up in a society where like there was no option. Like, how dare you talk about abortion when the Bible says go ye forth and multiply?
My name is Sharon Mwarinda. My pronouns are she, her. I live in Kisumu, and through 3W I am a safe abortion champion. I would see young female bodies who would go seeking for an unsafe abortion, and then they would have very dire health complications.
My name is Royal Didi Viona, but I prefer Royal. I come from Vihiga and I'm a member of the COBAST, Community-Based Strategic Team. And my gender identity is I am a trans man. The project has done quite a lot when it comes to knowledge gap within us as human rights defenders. And I believe that since we are already educated, other people are also going to be educated too. It has had an impact when it comes to sharing the knowledge within my society.
I was involved in 3W trainings about safe abortion. I got to know information in legal and also medical sides that will really help me in the activism that I am in my work in activism. It has had an impact on me as a person, as an individual, because we will see young people in all their diversities seeking for safe abortion, but they do not know where to go to for this help. They do not know the community to go to where they will be understood and where they will be taken in. And so I am sure that 3W has provided that space where we could share.
Because I mean, everywhere, like, things around us used to like just tell us that abortion is a crime, abortion is a taboo. Even the kind of music we used to listen to. Number one, I just said it, abortion is not a crime, and abortion is health care, safe abortion, that is. Yeah, I've learned what the Constitution says about abortion. I have learned how to navigate, you know, what a safe abortion looks like and what an unsafe abortion looks like, and what to do in case I find someone who's probably trying to have an unsafe abortion, maybe due to lack of information, can refer them to, if not 3W, then the networks that we've created during the workshops, during the project as well.
I really want a lot of tapping into the rural areas. Like, we need to have a lot of people brought into these spaces and given the information, because as much as I have the information and I share it with other people, the information that I'll share will be right, yes, but the information that they'll go and share back there, you know, there's always a communication gap in between. So if they get it one-on-one from the trainer and from us to as the champions already, it's gonna have a great impact.
Our thoughts and our problems, and we will be like together and create that safe community.
My name is Sela Babu. I'm a lesbian woman. My gender pronoun ZE/POI. I identify as a woman as assigned at birth. I can share this even with my beneficiaries, not just 3W beneficiaries, but this is the information that I've received from 3W. I can share it down, filter it down to my organization members, and so the information has also kind of brought in like more collaborations, more linkages, because I would say from the interaction that I had with KMET and through 3W, that now when it comes to even accessing safe abortion care or safe abortion and abortion, post-abortal care, we know who to go to. So I feel more confident even as a director that I have this knowledge that actually I've been able to share with some members. In as much as somebody is a health professional, it does not necessarily mean that they know how to do abortion or their values. They might know how to perform abortion, safe abortion, but their values don't go with that. So I would like to see more interactions between 3W and even experts, and even if the community-based strategic team can also get to have like a round table with the experts, so that we get to know their perspectives and what are their needs in terms of learning, but they also learn about the needs of queer persons, LGBTQ women, in terms of learning, so that we have survivor-centered approaches or LGBTQ women-centered approaches when it comes to handling this as a health need in a hospital or something.